Welcome back to another fabulous episode of Healthcare Trailblazers. I am very happy today to be sitting with my good friend, Scott Alexander. Scott, thanks for coming by.
Thanks, Mendel. Glad to be here.
Absolutely. Scott is not only a former partner, in a sense, we worked together on some really interesting campaigns, but Scott is someone that was the Vice President of Innovation at Mercy Health System. Really interesting role there. And then is on a journey today to, and correct me if I'm wrong, we are on a journey today to really help improve and fix communication in healthcare on a variety of different levels. And you're doing that for a number of years in a really successful fashion. It's going to be a fascinating conversation. So thanks again for stopping by.
Yeah, thanks. I'm glad to be here. Yeah, it's we've been talking about getting this on the calendar for a little while, and I'm glad we were able to make it happen.
Yep. As you know, we love talking to fascinating individuals, and you're at the top of that list. So we're excited. We're excited to jump in here. So healthcare, big profession. You talk us through a little bit of how you started your journey, some interesting highlights, and we could jump into what you're doing today.
Yeah, sure. So I grew up in a medical family. My dad is a physician. My mom was a nurse. They met when they were in their respective schools. I grew up thinking I was going to be a doctor until my dad sat me down right before I started undergrad and said, basically, as EMRs are rolling out, he's like, if you go to medical school, you're basically going to become a computer technician. And that's not really what you want to be doing. That's not medicine. And so I went the business route instead of the medical route, but it's just kind of in my blood. And so after school, I went to work for first GlaxoSmithKline and then Medtronic for about 9 years. And then ultimately the Mercy Health System, which is based here in St. Louis, where I ran innovation and product development, and that sort of thing. And I saw this really, frustrating trend. So in my role, I would see really great companies that would have a better mousetrap, and they would want to be able to figure out how do we get people to adopt this so that we can get better outcomes for patients. And I would also see patients that had a medical condition, right? My father-in-law is a great example of that, diagnosed as having diabetes, treated as a type 2 diabetic for years before we went in and got him tested for the antibodies that are only produced if you are a type 1 diabetic. And so I saw all these issues with healthcare and the fact that it's really hard for people to know what the right answers are and to get the right kinds of solutions to live their optimal health. So I left Mercy back in 2018, sort of September, October of 2018, on great terms, right? They're wonderful folks, but I had a journey I needed to go down. And so I bought a company that does direct-to-patient marketing. We started a company that does more B2B type marketing. Okay. And the whole idea of what we're doing is helping to improve healthcare, hopefully just at least a little bit, by improving the communication. How do manufacturers talk with physicians and other healthcare decision makers, and then how do those same physicians and healthcare decision makers talk to patients so that we can improve the quality of care that people are getting.
Fascinating.
Yeah.
Wow. So digging into the pain point a little bit, obviously, healthcare is massive, and I think pretty much everyone will agree that there's a lot that can be fixed in healthcare. But this, it's really interesting that you honed in on a very specific issue, and that's the actual communication. Because, like you're saying, there's a lot of good ideas in healthcare. There really is a lot, but you're saying for people to kind of find each other, and for patients to find the right decisions that are applicable to them, and all that is really what you honed in on. So, what are some of those specific pain points? What are some experiences that you saw that made you realize okay, this is something that I'd like to take on?
Yeah. I mean, I think about my father-in-law and the experience that he went through, right? Being diagnosed as a type 2 diabetic like everybody else, but that care not actually being what he needed. We had to actually have him switch endocrinologists. And it was actually a couple of times before we found someone who would even test him for these antibodies, right? And again, so that's an example. We had the father of a good friend of mine that I grew up with. Right? I'm from a small town in South Carolina. Like we know our neighbors, and the father of a good friend of mine passed away from pancreatic cancer. Okay. And pancreatic cancer is one of those areas like it's really, you're not going to last too terribly long, but the level of care that he was able to receive in my small town versus what he may have received had he been at Sloan Kettering or MD Anderson or that sort of thing was really different. And so Those were some of the formative experiences. And then I saw it over and over again on the B2B side as well, in terms of companies that have great solutions to improve care. And some of these were things that we were doing at Mercy and we were, helping other health systems with, and others were people coming to us, where, like, for example, revenue cycle management is a big area where I saw a lot of health systems that were not coding appropriately and didn't know the right solutions to be able to go and do appropriate coding to make sure that they were being reimbursed appropriately, right? And in many cases, that reimbursement means that they're going to make more, right? And that's straight to the bottom line. So it's things like that really tipped me off to this issue that needed to be addressed.
Yep, absolutely. So how do you let's talk about the solution a little bit. What in your mind is helping improve that, is a possible solution, and how are you going about that?
Yeah. I think it ultimately comes down to, if we think about healthcare, even though again, if we took the US healthcare system out and made its own separate country, it would be the fourth largest GDP in the world.
Wow.
That's just absolutely absurd, right? And absolutely absurd. But within that, there are actually a relatively small number of people that are making a decision on any given treatment modality or outcome, right? So if you think about that, so let's just focus on critical care management, right?
Sure.
So within that context of critical care management, even though again, we were talking about it before we started filming, around the changes that CMS is making, and that is an effort by CMS to get more people into critical care management and remote patient monitoring. And so as we look at that, the reality is you don't need 330 million Americans to all jump on board with CCM,
right?
Because there's relatively small number of people that are actually indicated for this. And so if you think about best practices from a marketing standpoint, really what you want to do is you want to start off by focusing in on those people that would be indicated for care, right? And again, either on the physician side of people who are treating patients or on the individual patients, and then nurturing those folks through a decision-making process, right? So again, if we think about the world that we live in today, this is kind of principle number 2 from a marketing perspective. The world that we live in today is, if you want to go buy a car, right? Let's say you want to go buy a Ford Ranger. I don't know, I just picked that out of the air, right? So we want to get a little truck. The reality is I can get about 99% of the way through the buying process before I ever have to talk to somebody who is working with Ford. I can get online, I can go to YouTube and see how to change the oil. I can do this, all these kinds of things, and I can educate myself through the process. If we think about ourselves in a healthcare context, we take the exact opposite approach. We say, we have experts. The experts are the people that know the information. You only need to know a little bit as is deemed appropriate by the experts. And oh, by the way, the experts are super, super, super busy. And so even though they right, so they're
experts. They've got what to do. Yeah.
Right. Exactly. And as we think about the entire system and sort of how reimbursement is done in the United States and that sort of thing, the reality is these experts who, for all intents and purposes and everything that we see, really wants to be educational, they just don't have the time to do it. And so one of the points of what we need to do from a marketing standpoint is, number 1, target effectively. And then number 2 is educate liberally, right? And again, we're not talking politics here. Educate as openly as you can, right?
Right.
And so there it comes into, how do you share information so that people can learn and get up to speed and have a better understanding, so they're more informed when those limited windows of time with the expert, and they can take themselves further down the path towards understanding what the right options are. And not to go too far on this point, but one of the things that we hear is a lot of concern around, I'm going to educate people towards things that they don't need. And I don't want to break anybody's heart here, but the reality is WebMD is already doing that, right? Dr. Google is already doing that. And so one of the things that we should be thinking about is, how do we go about giving the right information so that people can get into a process to educate themselves appropriately without having to sit in front of a physician or a nurse or whatever the healthcare provider is, and get up to speed and get some education so they can make those brief moments of interaction worth that much more.
Interesting. So I have a question for you.
Yeah.
In a lot of industries, and I think healthcare as well, I'd be curious to hear your thoughts. The challenge is not necessarily lack of information. Many times it's too much information. There's a sea of information. And I think when it comes to healthcare, you have that as well. So, the famous, never Google your symptoms, right?
Right. Yeah.
So where do you think the bridge is between educating yourself in an effective way and in a meaningful way, so that, like you're saying, you can really utilize your time with the experts, so to speak, in a much better fashion? Where's the balance between that and going down crazy rabbit holes, and every time you have a headache, you have cancer, right?
Right. Yeah. Well, and I think it all depends on the perspective that we want to look through, right? So if we're thinking about ourselves as a patient, really what I think the key to doing it as a patient is finding a trusted source, right? Finding an authority who is going to share the information that you need in a way that is digestible. And the key, if you are a provider and you want to be that source, is to think about a couple of things. It's how do you make sure that you're sharing relevant information, right? So it literally may be things like a differential diagnosis, right? Folks go to medical school, right? That is a big part of it, is if this, then that, right? And a series of those things. So if I'm a patient and I want to educate myself, what I want to do is I want to find a trusted source, or maybe a couple of trusted sources, to say, help me figure out this headache, what that might be. And there's a huge lack of that, right? Of places to go to say, hey, if you have a headache, here's a couple of things that you might want to think about. Have you been drinking 6 pots of coffee a day, right? It might be related to caffeine, or is this right? That's close, right?
Yeah.
So some sort of differential diagnosis would be valuable. If you're a provider, you may want to think about what are the common concerns that you'd have, or that a patient might have, and then try to address those in a way that builds a framework. That's one of the key pieces of all this. Is it's really helpful to have a framework to build all this content around, right? So if you're going to go in and you're trying to create content around critical care management or revenue cycle management, or you name it, right? Whatever you're trying to do, start off by explaining to people, here's how you should think about the problem. If you've got a headache, here's how you should think about the problem. And I'm making this up on the spot, but there are external factors and there are internal factors. The most common external factors that we would see for a headache are, number one, you got kicked in the head by your 6-year-old, right? As you're wrestling.
You were bull racing, right?
Right, exactly.
You were running with the bulls.
you were in Pamplona and something crazy. So walk through that process, and just being able to do that will give a lot of visibility to folks who are trying to learn about your content in a way that they can actually digest it.
So provide a framework rather than here, this is it.
Yes. Frameworks are critical to it.
Yeah, I love that idea, and I talk about that a lot. You see online all the time. Take fitness as a random example, but when I'm on YouTube and I see this guy, and he's ripped, and he starts and he opens his mouth and he starts saying his pitch. The second he goes, "This is what you have to do. I tried all these different things, and this is the way. This is it. This is what's up." I'm seeing this guy presently. I don't know why he ends up in my feed, but anyway, he goes on this ancestral diet, I think is what he calls it. He basically eats raw meat, organs like heart, liver, testicles, things like that, raw dairy, raw honey, and fruit, and that is it. Okay,
gotcha.
And it's interesting. It's intriguing because he's like he has this whole what.
Is this Liver King? I think is his name.
I think no. I know who you're talking about. Yeah, no, not that guy. That guy, guy's made the rounds. This guy, I think he goes by like Carnivore MD or something like that.
Okay.
He's a doctor too, and it's obviously intriguing because it's interesting. He's got this spiel. I am not a doctor. I don't know if it's medically sound or not. But he's got this spiel about how anything that's green, like any leafy things, especially seeds, so like any oils that come from seeds. So he claims, which on a theoretical level could make sense, but he claims that basically seeds have a bunch of defense mechanisms because the plants put all these defense mechanisms in the seed because that's what continues their DNA. So they don't want it being destroyed. So that's why you get, bloating and this and that. You've got all these problems that stem from people, thinking that greens and seeds and seed products and green products are healthy. So that's a spiel. Anyway, I have no idea if it's right or wrong, but the fact that, that like all these, quote unquote gurus, they're like, this is the way to do it. This is what I found and this works for me. And therefore this is the way. I immediately discount it. It's like, okay, no, because everyone's different and there's different body types and there's different, There's so many different variables that have to do with it. So I went on a bit of a random rant about it, but the idea of like provide a framework, that's helpful. Give someone a framework and say, okay, look at these, factors. And based on that, here's how I can educate you to make an educated decision or to find the right person that can help you give an answer that's specific to you. To me, that's someone, so like what you're saying, provide a framework, that's someone that you can actually listen to that seems to be valuable rather than like, here's what you do. And this is the only way. And if you don't do this, you're going to die.
Right.
It's like,
and I think that's the thing that, that happens is people get really sort of dogmatic when the reality is when you talk to the experts, there is a tremendous amount of understanding of nuance, right? So if you come in and you have these conditions, an expert in the, let's say you come in and you have high blood pressure and you've got, your typical syndrome X, dyslipidemia, high blood pressure, right? Some heart disease, that sort of thing. And a good expert is going to sit down and say, all right, well, let's think about what we would recommend. Are we going to do, we have these options, these drugs that we can put them on and this kind of exercise regimen and that sort of thing. But what's actually going to work in that context for you as an individual patient? And then that becomes what the recommendation is. Some of these things are, we know you always need to do the X, right? You need to always, eat less McDonald's, right? So that's going to be a universal truth. But beyond that, there's going to be some decision-making that has to happen. And really what the frameworks allow you to do is to get that out of your brain and into other people's brains so they can be much more intelligent about this. And if we think about where we're going in healthcare, or rather, if we think about sort of the trajectory of healthcare from a patient standpoint, what we're seeing is access to these experts, doctors, nurses, other healthcare providers is going down, right? Because of the Great Resignation, because of you name it, whatever, but access is lower. We have a substantial increase, in fact, in many cases, of co-pays and high deductible plans and that sort of thing. And so the outcome of that is patients are on their own to a much greater degree than they ever have been in the past.
Yeah.
And so they have to make these decisions.
Yep.
And the question is, do you want your patients making these decisions with as much information as you can get in a video or you can share in some sort of a content piece, or do you want them just to guess, right? Or go to WebMD or Dr. Google to try and figure it out because they have to do it. It's not like doing nothing solves a problem. Doing nothing is a decision, and it is frankly, in my opinion, a less desirable decision than going about and at least giving people a framework to think about these kinds of things, right?
Yeah, absolutely. I very much agree with you. I think we're definitely seeing that trend, that you're saying that patients are more and more on their own, especially as hospitals. I mean, the whole primary care space specifically, it's shifting in a very interesting way. And you see a lot of hospitals and a lot of bigger systems and a lot of, even like funds buying up tons of primary care. And the idea of like, Dr. So-and-so is my doctor, the old guy with the old office, and that's where I go to. And he treated my mother and my grandmother, and, that guy, we're definitely moving away from that. You're absolutely right. And we're moving to this, this kind of more almost automated health system that you kind of walk through. So the importance, to your point, the importance for patients to educate themselves, and specifically, and this is a very important part that I appreciate that you said this part, but specifically finding that trusted source, which is obviously critical because there's so much information out there, but finding that trusted source and then educating yourself is probably a good idea. And it sounds to me like what you're saying on the doctor side is be that trusted source. If you have people that are listening to you, doctors these days have panels of thousands and thousands of patients. that are maybe seeing them once a year. And, obviously the more involved ones are coming in more often, but you can have patients that they call you their doctor, talk to them. Is that what you're saying?
Yeah, absolutely. I mean, there's no reason not to do that. I think about like the changes that we've seen in telehealth. I had a conversation with a world famous hepatobiliary surgeon. This is probably 10 years ago. And the guy's literally amazing. One of the just amazing human being, as well as a really, really good surgeon. And he was telling me, he was based in New York City at the time. And he said that half of his patients come from the 5 boroughs of New York City. And the other half are people that come from literally around the globe, because of, sort of bad genetic lottery, they are diagnosed with liver cancer at the age of 30 years old, right? Or some really young age. And so they'll do anything they can to go and find the world's best HPV doc or surgeon, right? So they would fly to New York City to see him. And I think about that. And then I think about the changes that we've seen from a telemedicine standpoint, right? And so some of the laws that we've seen changed since COVID started, and the way that you can actually create relationships digitally.
Yep.
So if you're in a small town in South Carolina and you have a particular expertise around fill in the blank, right? You're just making this up, like athletes that have really bad cholesterol. There's no reason you can't become the go-to. You can actually have doctor-patient relationships with people that would normally not be in your small town, but maybe they're in the big cities, or move to another state that has more folks. Here in rural Illinois, but you know how to treat X really well, and you want to really become an expert in that. Then you can go about creating a solution. In fact, we've got a practice that we work with that's based in Denver, and been working with these folks for a long time. When COVID hit, the practice owner and I sat down and talked about, hey, how do we want to go about sort of making sure that you remain viable through all this? Because we don't know how long this is going to last. This is like March, April of 2020. And he pivoted towards fertility, right? And sort of hormonal issues around fertility, and is now treating patients across the country.
Wow.
And he's doing great things. I mean, literally, we have video testimonials from families that have children because of the work that this gentleman has done, right? And I think that's the possibilities of what we have. And so if I could kind of build a framework as to how do you do that, right? So number one is he understood who he wanted to treat and what he was passionate about in his practice. We helped him build frameworks to help educate folks. And then we helped him get out to those kinds of families that have been struggling. They're not ready to go the IVF route yet. They're trying to figure out what's the middle ground. And incredibly successful case study of he's pleased as punch. He's got families who are absolutely in love with this man. And it all works because he's kind of doing the process that we're talking about here.
So what actions did he take to reach that wider audience? Did he do webinars? Did he what specific actions did he take to really expand his audience? Yeah,
I mean, so basically, so he did a series of webinars.
Okay,
was number one. We did Facebook ad campaigns, which I'll tell you is a lot of times when I have a conversation with somebody in a healthcare context, and I'm like, by the way, Facebook, you can see like the lights go off. I'm like, no. When the reality is, like a third of Americans are on Facebook.
It's interesting. Yeah, I think just myself moving from New York to Northeast Pennsylvania, I think the cities, you might have better data on it, but I think that it is becoming less and less prevalent in the cities, but I'll tell you out here, it is huge. I mean, community groups, and I mean, that's where people, and I found that to be shocking. But it's really meaningful. I mean, if you want to do some damage in the neighborhood, you get on one of these chats and you say something, and
feuds going on.
You start the firestorm. That's where you start it. It's pretty interesting. Yeah, you're right. People are
start trashing the Eagles or something. I mean, I think here's the reality, because again, whether it's Facebook or it's Instagram or it's Snapchat or TikTok or you name it, right?
Mhm.
People want community and people are using social media channels. And so the reality is, if you know who you're going after, that is one of the best ways to go and build interest is on a platform like Facebook because of the ubiquity of the platform.
Mhm.
The same is true, by the way, because we also market on behalf of technology providers and solution providers and that sort of thing, where you can market to physicians really well on Facebook because doctors are people too, right? They check out their
Surprisingly,
high school friends.
they change their name typically on Facebook because they don't want patients finding them, but they are still there.
There are. Yes, yeah, and so what we were doing with the practice in Denver was we did a series of webinars. We did Facebook ad campaigns because again, you can target fairly well on Facebook to find folks that would likely be good fits. Had a series of follow-up emails so that if someone showed interest, we could follow up more emails. And then the other thing, and I give him all the credit for this, was he just started getting on and shooting quick little videos, right? So not 45-minute webinars or seminars, but 45-second snippets around, hey, if you're having challenges with fertility and you're eating onions, I'm just making this up, but like you're eating onions, you should know that onions contain a blah, 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 blah. You should probably think about putting the onions down and focusing in on something else. Like that kind of information. So he's just giving little snippets. And then again, sharing that.
Where did he put those? Facebook?
What's that?
And he put those on Facebook?
Facebook, Instagram. Yep. And so, it wasn't like a switch got flipped overnight.
Yeah, it never is.
But it happened, steadily and consistently as people start to get more interested and they tell their friends and that sort of thing. And that's ultimately what this is about, is how do you give good healthcare to people that wouldn't know about it, right?
Right. Very interesting. So we're telling doctors, hey, start talking to people outside of your office, essentially. Bring them in on a virtual platform, create some content, it seems it's in almost every other industry that seems so basic, but in healthcare, that's almost cutting edge. Now let's talk objections for a second, because I'd imagine doctors are busy. I mean, not I'd imagine. We all know doctors are busy. What are some of the common objections that you get when you're trying to get this message out there?
I think it comes down to I don't have time. I don't want the liability.
That's a big one.
And I just don't know how to do it. Right. So like those are kind of the big three that you run into.
Okay.
And what I would say is think about what you want your practice to be. And because, another one of the trends that we see in healthcare is, and you mentioned it earlier, private equity funds, but also health systems and other people are buying up primary care practices. We're seeing that trend move into the specialties. And a lot of the reason why that's happening is a lot of physicians are just burned out and they don't like what they're doing. Right. And totally respect that. I think one of the questions that everyone should ask themselves is like, what do I want my practice to actually be? And if I really like fertility, like this practice in Denver, then why do we not think about fertility? Or if we really like, managing people that have complex care, like why do we not go about doing that? And so you have to start with the why, right? Of, okay, well, why do you want to do this? Because if you look at it and you're like, look, I just want to come in. I don't really like, there's nothing that really fills my bucket or turns my crank or whatever. Like, it's maybe not the right thing for you to do. Yeah. But if you want to create something that's meaningful, that people come to you and see you as a true expert, then by golly, it's worth the time. And, put the right caveats on there that this is not medical advice, but something to think about. Like those are the kinds of things you need to do. And from a time standpoint, here's what I would say is if you can designate 15 minutes a day, you're going to be absolutely crushing it. I mean, that you don't need that much time, or find a partner, right? That can do it for you. Those are the kinds of things you want to think about to overcome those objections.
Right. Smart. Let's dig into the liability a little bit, because that's definitely, something that went out from my head immediately. Obviously you're not a lawyer, but is there any advice that you've come across in the past from some professionals in the space that can help doctors with that?
Yeah, that's true. So my wife, we went out
Quick
to
disclaimer on this whole webinar. None of this is medical or legal advice. Okay, go ahead.
Pretty much. That's the answer. But
okay.
My wife is wonderful. She's a fantastic cheerleader for me. And we were at a trivia night one time. And when someone was like, "Hey, where do you work, Scott?" I was like, "Mercy." And my wife out of nowhere is like, "Not a doctor." So, also not a lawyer, not an accountant. But in general, what I would tell you is just kind of be smart, right? You want to put your caveats in there and your disclaimers like, this is not medical advice. This is not constitute. So that's number one. This is not medical advice. Number two, this does not constitute a physician-patient relationship. It's kind of the other thing that you want to put in there. And so like, those are the kinds of things that you want to caveat. But in general, that's what I would think about. Right.
But at the end of the day, now kind of talking to the doctors, like, don't let the, there's a term for this. Don't let the bad, ruin the good. There's a better term for that. Do you know what I'm talking about?
I do know what you're talking about. Yeah.
Whatever. Anyway.
Bad apple. Yeah. Whatever.
Yeah. Right. Yes. What is it? Bad apples.
Bad apple spoils the bunch.
There we go. I would, something like that.
Yeah. I think ultimately,
like, don't not put out content because you're afraid of these things. You should be afraid of them. Get them sorted.
Yeah.
And then go build yourself an awesome practice.
Yeah, exactly. And I would go with be aware of them.
Yes.
Right. So understand the liability that may be potentially coming from it and protect against it. And
I
mean, the easiest thing to do, if you really want to do this, if you're like, yes, I want to go and teach the world and make this practice and what I want to do, there are about 1,000 people that are already doing this.
Yes.
That have already gone through those things. And so go to their, just go in and go to their websites and see what they're saying and what they're doing. And
that's not to, to plug you, but that's exactly what you do. I mean, reach out to Scott or someone like Scott, but no. And this goes back to, doctors specifically, because they're so limited in their time, they need to really think. And this goes back to the point that you just said earlier, like, what do I love doing? How do I do more of that? And how do I do less of all the things that I don't want? And I think a lot of the burnout that we're seeing across the industry has to do with that they're overloaded with a lot of the tasks that they actually have no interest in doing. And those are the things that are burning them out. The things that they love to do to actually practice medicine, change someone's life, heal somebody. Who doesn't love that? Everyone loves that. What they don't like is all the administrative stuff, and now, something like you're talking about, okay, on top of all that, you got to put out content to do. It's like, I don't know what to do. Well, don't do it. Call Scott, call Mendel for your chronic care management. Get in touch with somebody that will partner with you and take on the parts of your practice that you're not interested in doing. Don't fill your plate up because you're going to burn out.
Right. Exactly. Yeah, it's absolutely true. And focus on those things that bring you joy and offload the rest of it. Right.
Yeah, exactly. Very interesting.
Mm-hmm.
So where do you see this kind of going? What's the, I'm sure you have a number of success stories. We went through the one in Denver. It's very exciting.
Yeah.
In your mind, a doctor that is doing this perfectly, what do they look like today?
What do they look like today?
What are they doing? What actions are they taking on a weekly basis, on a monthly basis? What does that avatar almost look like?
Yeah, I mean, I think it's someone who's purpose driven. Is kind of step number one. Is they've kind of figured out like, hey, this is what I want to do, and they are shooting. Again, if I'm going to give you like, hey, here's what you need to do once a week. This is what you do: is you spend 15, 20 minutes. You shoot 3 to 5 videos, and I'll give you a couple of scenarios, right? Because this is like, there's nuance and everything, right? Like we talked about earlier. So. Your easiest thing to do, you're shooting 3 to 5 videos, you're posting them on Facebook, Instagram, maybe you're doing it on LinkedIn, right? Because that's kind of a fun platform from a marketing standpoint. But you're doing that. If you want to go to kind of the next level, you've got some sort of email campaign where you're sharing insight about what's going on. And then sort of like if you're hitting a home run, you or your hospital or your the organization location where you actually have privileges, if you're a procedural, if you're doing surgeries or procedures, whatever the case might be, you're running some sort of paid ad campaign on platforms like Facebook. Google's another great one to go after, and put your content on there. But to bring people in who are interested in your kind of care. So those are the three things that you probably end up doing. And I mean, we can talk about, like, we have a practice in Los Angeles, an orthopedic surgeon who's fantastic orthopedic surgeon, great technology, right? His belief is to focus on how do we go about educating folks towards the differences in the technologies that are available, right? So in surgeon A's hands versus surgeon B's hands and that sort of thing. And that's critical information for someone who's exploring a joint replacement or whatever the case might be. And so if you're an orthopedic surgeon, that's the kind of thing you want to think about. It's like, how do I help? Again, my wonderful father-in-law had a knee replaced. And so we had to go through the process of figuring out, like, who's the right person for him to go to.
Right.
And it sure would be nice if somebody could sit down and say, hey, if you're in Louisville, Kentucky, and you're exploring potentially getting in, if you think you might be a candidate for a knee replacement, these are some of the things you should want to consider. Like, what does that look like? Because you build expertise, and that's ultimately what's going to bring people into your practice, because they trust you, right? They know that you know what you're talking about, that sort of thing.
Right. Absolutely. Yeah, it's a powerful thing these days as the world, becomes more accessible. And you're right. This is really, it just hit me that the reason why this is almost cutting edge in healthcare is because it just happened. Telehealth, like you said, telehealth just became a thing. Even 4 years ago or 3 years ago, whatever, 2019 prior, what did I say, BCE, before COVID era,
Right, there you go. Yeah.
There was the only point in maybe creating content was to get yourself famous if you needed that kind of attention. But today,
right,
you can help those people. You can hop on,
yes,
via telehealth. You can hop on with them. And today there's all types of, you said you were the chief innovation officer at or VP of innovation at
just
Mercy.
the little VP. Yeah.
There's so many new technologies out there. There's this one Israeli company, I think it's called Tito Care or something like that. Tito.
Yeah. Tito. Yep.
Yeah. Tito. You familiar? Yeah. Really cool.
Yeah.
For those that aren't familiar, I mean, it's and I don't know anything about them, never, but it looks cool. Where you kind of can send your patients like a little kit, and it's got like a bunch of little attachments almost that go into this camera function, and you could basically do like a whole ENT kind of thing where it can look in your ears and your nose and your mouth, and you can put it on your skin, and then you start talking about dermatology. You can do a lot of these things. You can actually expand your practice beyond your four walls.
A couple of interesting companies. So there's a company called Withings.
Okay.
Withings.
Withings. Okay.
Withings, yes. That has a number of, like, they've got a scale and a watch and other sort of remote monitoring pieces that are really valuable. Big effort on the B2C side. So they sold stuff to patients, for kind of personal use. And then I know they also do it in the healthcare setting. So working, devices that can help a practice that has remote patient monitoring. And then like specialties. So even like Rhythm Science is a great company in the cardiology space. So they're helping with monitoring patients that have pacemakers and ICDs and things like that. And so like an EP practice would benefit from that sort of thing. There's a bunch of other companies. Those are just two that pop into my head. But it's true. Like you now can extend your practice in a way that you've never been able to before. And people are just kind of used to it. Like it's what they expect. And so, I mean, I think be purposeful. Like, I think you can be purposeful about the things that you really want to focus in on. Another thing that you can do, again, if you're just, here's the reality, right? So I'm an innovation guy. My whole thing is like, we got to fix healthcare. And so let's come up with great ways to do it. The best way to do it is to do something, and know that your first iteration is probably going to suck. Like, there's just not another way to say it. Like, that's just reality, right? Like
it's reality, and it comes down to the understanding. I think that's a very difficult thing for people that are just starting out to understand, because you don't have the advantage of time behind you. When you're just starting out, I have this theory. I think I've told this to you, but I have this theory that it is impossible for someone to, on a meaningful level, plan or think ahead beyond the amount of time that they have behind them. So
Mhm.
in whatever specific thing. That's my theory. So
Yeah.
meaning I don't know if it's true or not, but that's what I think. And you know, like when you start in business, like if I told you that, you know, you would have to chase down a lead for 2 years, you'd be like, get out of here. Like
Right.
if it's not closing in 24 hours, then what am I doing? You know what I mean?
Yep.
But somebody that's got 10 years experience, they can actually think 5 years ahead and plan 5 years or 10 years ahead because they know, you know, what transpired before that timestamp.
Yeah.
So yeah, know that it won't work out, and that's fine. But you need to go through that. You need to
Yeah.
start it and try it and mess up in order to get to the good stuff. There's
And
no way
here's
around
the
it.
thing is that you're going to mess up and nobody's going to notice. Like
Exactly.
that's the thing that people
No
don't
one
realize.
cares. People are too narcissistic. They assume people care. No one cares about you.
That's right. We were talking. My wife and I were talking with I have a 10-year-old son. I have many kids, but that's my oldest. And and so we were talking about, hey, when you have a picture put in front of you, a bunch of people and you're in the picture, who do you look for first? You look for yourself. Like that's just
Absolutely.
a natural normal, right?
Yeah.
And so the whole idea is like nobody's worrying about did you stutter on this thing or whatever. Like nobody cares until it's relevant to them. And so go out there and give it a shot. I was actually, one of the things I was going to say is if you want to just try it and you're concerned about some of the things that you needed to do in terms of liability and all that, just start with your own patients, right? Just go in and say, hey, look, I'm going to do a quick email series on the eating right. I mean, here's just like really obvious things like right ways to eat. Hey, by the way, again, maybe the carnivore MD would disagree with this, but like you should be eating your leafy greens and this kind of thing. Right. And just that sort of educational piece, because I think you're right. Just kind of getting out there and trying it you'll learn things that you didn't know even existed. So.
Yeah, and bringing back, I've now in my brain, I've come full circle to understanding. You know, before I was saying that the too much information thing is possibly a challenge, but it opens up the opportunity to do exactly what you're talking about because there's so much information out there. I mean, I know for myself, I do not trust anything fitness or anything diet related because there's so much out there. And you click on one video and it's saying this is the way to do it, and you click on the next video and it's the exact opposite. So you just don't trust anything. So if you're the doctor and you're your patient's doctor, you are their trusted source. So just open the camera and say something, even as simple as eat leafy greens. If that's you as their doctor, if you think that is a healthy thing and that's what your patient should overall be doing, then and it seems super basic, but you're the trusted source to talk about it. So the fact that there's so much information out there gives you the ability to stand out as, you know me, we have a relationship. You trust me. Here's actually what I think, you know?
Exactly. And make it leafy greens, don't eat McDonald's. Like, there you go. Right. You have 2 weeks worth of content.
Right. I was watching, I think it was Joe Rogan, and I forget what the context was, but he was basically saying, he's like, okay, you know how to be healthy. Move once a day and don't eat garbage. Like, you can, if you want to look the exact way, you want to tone up or bulk up or tone down or whatever it is, then you start, but like, you want to be a healthy person. Like, it's not actually rocket science, here's the framework. Like you said, this is the framework.
And, Joe Rogan's a great example of somebody who does that really well. Number one, is super conversational. So it's not like he's giving a lecture, but it's just like he's having a conversation with somebody. And number two, he does a really good job of building a framework that you can follow through his stories. That you walk away and you're like, oh, that's really interesting. So he interviews really, really smart people. Peter Attia is a great example. If you talk about fitness, where is a physician, I think he's out at Stanford or somewhere like that. He talks a lot about sort of optimal fitness and that sort of thing. They're talking about super, I don't want to call them nerdy, but like super involved concepts. And it's very digestible because it's just very conversational and there's a good framework around what you're trying to do. And
he definitely brings things down to kind of ground level very, very well.
Absolutely. And so I think as long as you're doing that and you're doing that in context that you care about the topic, then the content just flows. Because I didn't mention that, but that was one of the things that people that is a concern is they're like, I don't know what to say. Well, here's the reality, right? You have medical school and how many years of training for a physician, or you've got how much background.
Yep.
And the things that you're like, well, obviously you should be eating leafy greens and not eating McDonald's. That is not so obvious to the rest of the world.
Yeah.
Because
you've got Carnivore MD out there saying,
right.
Yeah. Wow.
So, yeah.
We're really bashing this poor guy. I don't even know him.
I know. I'm sure he's great. I'm sure he's great.
I'm sure he's a nice guy. He looks sharp. You know what I mean? He's got all 7.5 abs, you know? So.
Yeah, exactly. And let's just be honest. I haven't seen mine in a long time, but
kids will do that to you.
Yeah.
Yeah.
It's true. I mean, I think, but all in all, like, this is an exciting time to be in healthcare, right? As we think about what could we imagine what the world would be like without the internet for common life, right? No, like there's no, I can't imagine what life would be like if we didn't have the internet anymore. And we've just had the internet come into healthcare, a couple of years ago.
You're right. What a hopeful message for healthcare, which is so contrary to what everyone's all doom and gloom these days, you know?
Yeah.
You're right.
I mean, I think I like to build people up, right? So it's all about making people feel good, feel better about themselves, because I really do feel like there's an attitude or a frustration, a legitimate frustration, by the way, with the changes that are going on in healthcare. It's certainly become more corporate and commercial, right? Certainly we've had separation between physicians and the doctors and their patients and that sort of thing. That's a frustration. There's expenses are going, like there's a lot of things that are going wrong, but there's also a lot of things that are going right. We interviewed a physician who he's in Washington, D.C., and he does house visits. He does house calls for his patients in a concierge medicine type of a format. To me, that's awesome. Like, if you think about it,
big believer.
That's what my dad used to do years ago, and now it's coming back. And I think that goes back to just figuring out, like, what do you want your practice to be like? If you're a patient, figure out, like, what do I want my health to be like? Like, spend an afternoon figuring out, like, what does winning look like? And then know that the tools are there in a way that you've never had access to before. And so if you're running a practice, you don't like it, change it. Right? If you're a patient, you don't like your health, change it. If you're a manufacturer, you don't like the growth of your adoption and that sort of thing, change it. But there's nothing keeping you from stopping it. So except for your own decision to move forward.
Absolutely. Wow. It's always really enjoyable. Typically Scott and I will get on for, a 15-minute scheduled call, and we'll end up sitting there for an hour. Just this is actually very smoothly went into our typical conversations, but it's always really interesting talking to you. You have a great perspective and a very uplifting and positive outlook and attitude. And I suggest anyone that is interested in getting better at their communication, whether that's to your patients, whether that's B2B, if you're looking to talk to doctors or doctors trying to talk to each other, I would definitely recommend getting in touch with Scott. We'll definitely have, all the relevant links and how to actually do that in whatever description on whatever platform you are seeing this on. And there's maybe a closing message that you'd like to tell some of the good people?
Yeah, I think ultimately this is a really exciting time. And the idea that we can make a decision about what we want to do in healthcare and we can actually fix it, and maybe not completely, but to a pretty good extent. I think this is one of the best times to be in healthcare. The overall purpose of why we do this, to care for those people that are in need, is not changed, but the tools that we have to do it are catching up rapidly with what we expect in the rest of our lives. And so, I'm excited for what we're going to see coming out of this, and the number of people that are going to come out and figure out how to make it into something much, much better than it is today.